there's like 4 phases of ortho-bionomy. And it has to do with how big of motions you use. So you can use real subtle motion or you can use big motions. And then there's points. So there's shoulder points. So I want you to tell me, is it sore here or here? Here? This one?
No, keep going.
There's one here. Is this tender at all? This one feels a little grumpy.
Well, this one was,
Oh, I see you have a little scar there.
apparently there was some.
Big scar, actually. So relax your arm. We're gonna see if we can soften this point. So it's most tender right here. Well, tender or tight. So sometimes it's not tender where it's tight, and you just know by feel. So then you just relax your arm. It's important that you just relax all the way. Let me help you. Oh, she's helping me. Yeah, just relax. Okay, now push your arm down towards the floor. No, not with rotation, just your elbow. Dig your elbow down. There you go, there you go, there you go. So that softened this point. And relax, relax. And relax all the way. Let me hold your arm. It's either on or off, okay. And then relax. Let it go. Heavy arm. Don't hold it up. Drop it into my arm. There. There you go. There you go.
No, not really.
So you want to move out of the pattern slowly, right? So you keep all those muscles relaxed and all that tension calms down. And this point is just softening under my finger. And sometimes I do use breath because that helps you release, even if you didn't spontaneous take a breath of air. So breathe in. And on the exhale, we're going to lower that arm. Just exhale, relax, relax, relax. Okay. Relax there. Now, is this a comfortable position? Any pain with this position?
Yes.
Okay, let your arm push down into my hand. And then relax it. Don't let it push anymore. Relax there. She's having a hard time relaxing. So probably what I do is have her lay down, you know. And you're going to elbow me. Boom. Kind of give me an elbow back. Push back into me. With your elbow, push into my hip right there. Okay, and then relax. Relax. Let it go. So I would probably treat her shoulder laying down. But can you raise this arm up for me? Over your head. Is that comfortable? Okay. Do you have any area where it's particularly painful?
Just right in here.
And relax. Is this uncomfortable back here? In this position? Is it more comfortable with a little pull or a little push? Don't help me. Just relax. Here's a pull. And here's a push. Push feels more comfortable. You feel all the muscles relax around that shoulder? Take a deep breath in. And relax everything as you exhale. Good. Right here. Is this uncomfortable right here?
Yeah.
Is that better?
No, that's good.
So she just relaxed her arm, which tells me that's a position of comfort. She no longer has to help me hold it. Right? Is that comfortable?
Yeah.
And then take a deep breath in. And exhale, relax everything. Good. And then just, does this feel better back here? Oh, it's softer. Do you feel that?
Good.
Good, okay. So it's really that simple. So just, thank you for, Lydia, for coming up and helping and demonstrating. How's your shoulder feel? One of them feels good.
And then I go,
So, anyway, ortho-bionomy is one technique that I use to help people move better and have less pain. And it's very simple and it's pain-free. It should be pain-free. So if it's not, you need to talk to me, because it has to be communicated. Both sides need to communicate to one another. Because sometimes I feel things that you feel that I don't feel. So I do treatments. Samantha said that I can come here to do treatments in your rooms, or she'll set up a room for me to have my table in and work with you. If anybody's interested in having a treatment, or maybe even buying a gift certificate for a loved one for Christmas or something to have a treatment, somebody that you know that has pain or is struggling with being active in their life, that they really like to do the things they like to do, and they're not able to because of pain in your foot or your knee or your shoulder. Maybe you have headaches. What's your question?
She has, what is it,
Neuropathy.
neuropathy, do you do anything for that?
Neuropathy is, I have had some people, if you,
Nerve pain, yeah, from diabetes.
yeah, it's an underlying disease process, but I have worked with people on their feet with phenomenal results. I did have a gentleman who had Parkinson's and neuropathy, and after I spent like an hour and a half on his feet, only his feet, and he had better balance when he stood up. He could feel the floor again. He had less pain, and so therefore he walked better, right? So yeah, it does work, not all the way, because of neuropathy is a progressive disease. But, I mean, just the idea of lessening tension around the joints and lessening the tension in your whole system, that it's going to help.
If you come out now and we want to get together, what is the charge?
So I usually do hour-and-a-half appointments, and they're $100 for an hour and a half. I was thinking that here, because it's pretty simple, if I just had a place and I had one day where people were coming in, it'd be easy to do hour treatments possibly. I just think hour-and-a-half treatments is more effective to then show you some movement too that you could do, and maybe a few really simple things you could do yourself at home, so to carry over the progression of the treatment. So I was gonna do $85 for an hour treatment if that's more affordable for you. But I do recommend the hour and a half because you just have a more solid treatment.
Is this something that Medicare covers?
Nope. Not covered by Medicare. A good question. So, any other questions about the work?
What can you do for backs?
Yeah, there's some good stuff. I mostly, when you're treating backs, it's mostly laying down treatment. So there's positions of the hip. A lot of times if you're not moving your hips properly, your back pays for it. So there's a lot of hip motions that help to release the back. Did you want to?
Well, I've had 3 surgeries on my back, and it's
Great.
just, sometimes it's so unbearable, I
Yeah.
can't understand it.
Yeah, so by releasing the hips, that gives your back more freedom. I didn't bring my spine, I was gonna bring my spine, but you'll notice the hip joint is a pretty big, very mobile joint, and when that's not moving well, it'll translate, you'll get movement. Like if I can't bend forward at my hips like this, maybe my hamstrings are tight, right? I'm going to bend at my back, right? So then that starts wearing out these little joints. They're not meant to do as much motion as the hips are meant to do. So if you can get the hips more mobile, your back doesn't have to do all the extra moving. I mean, it does move. And then there's really simple things you can do before you get out of bed to help loosen things up and not hurt yourself when you get up, you know, or be less painful. Because I wake up every morning and I feel like an old lady walking to the bathroom, you know. I'm like all stiff. But by the time I get moving, about 25 feet in, I'm better, you know. So I understand. Any other questions? Okay, well, I have pins